RADIANT-4 was designed to assess everolimus in the treatment of patients with non-functional neuroendocrine tumor in lung origin and GI origin against placebo. This study really have learned from a previous study, RADIANT-2, which was assessing the use of everolimus in conjunction with somatostatin analog, octreotide, in functional neuroendocrine tumor. However, in RADIANT-2, there was an issue in the sense that the patients were allowed to cross over from one treatment arm to the other treatment arm when there was disease progression, and the disease progression was actually assessed by investigator. So there is a bias that the investigator can potentially move the patient from one group to the other too quickly. So RADIANT-4 was actually designed so that patients were only allowed to cross over once the primary analysis of the study was done, and therefore the data were much more robust. And in this particular study, what they have shown is the use of everolimus has resulted in a highly significant, both statistically and clinically meaningful improvement in progression-free survival with everolimus compared to placebo. And there was an absolute improvement of 7 months, and I think that is definitely clinical meaningful. Until recently, there has been a lack of high-quality randomized controlled trial assessing treatment in patients with lung and GI tract neuroendocrine tumors. Especially, there's complete lack of molecular targeted therapy data in this particular setting. One of the most important parts that will really change practice is in lung neuroendocrine tumor, which is a poor prognostic group of patients with neuroendocrine tumor. And there was a lack of data really from previous randomized controlled trial. And in this particular study, there was a good proportion of patients with lung neuroendocrine tumor. So I certainly think that in this group, the use of everolimus will now become one of the standard options in treating these patients.